a team. The students are part of that team. The staff's a part of the team. We want them to be cohesive. And when you walk in the buildings, as many of you have, the staff and the students work really well together. We don't have issues in our school generally with the type of students that we have. You would generally feel like this would be a dangerous place, and it's not. The kids and the staff are taught to work together and be part of each other. We want that for them. They need that. Most of our day is academics, but 2 hours of every day is spent on therapeutics. So when a child is assessed, when they come into our school, when they're assessed, if they have anger management issues or grief and loss issues, drug and alcohol issues, life skill issues, then their treatment, their individual treatment plan is formulated to include those therapy sessions that they need to be successful. So I want to make sure that you guys realize that it's not just about the academics and the remediation. It's about that whole child. What is it that their family needs? Is there family issues? Does that child have grief and loss issues, abandonment issues? Those are things that we want to assess and to begin to address so they can be successful in school. Our typical student profiles. Truancy is a big issue for us. Drug and alcohol use is a big issue for us. Mental health is a really big issue. So we want them to be assessed by a therapist and a psychologist to be able to formulate a treatment plan that's going to be effective for them in the long haul. We don't want them to come and go until they're ready to leave us. We want them to be able to handle going back to their regular school, which is where we want them to be. We don't want them to spend a day longer with us than they have to. But a lot of times what we find is that the kids who are with us are beginning to realize that they can be successful for the first time in a classroom. And they want to stay because they do feel like we do care about them. It is a caring, very loving environment. That's what we hire, that's what we want. So we want them to be able to migrate back to the school, to your city school systems, but we want them to do it effectively. We don't want them to have to come back and revisit us. It's individualized instruction. So the treatment plan, the academic plan is all formulated individually. The assessments, the educational assessments, and the prescriptives are really important. We want to know where they are functioning in reading and math, especially. We want them to be able to get the individual educational help that they're going to have, and the remediation. That's why the 260-day calendar is so important to us. Year-round school is extremely important because they are so far behind. We have Saturday school, and the kids are, once they begin to learn that they can be successful, then they intend and want to attend school on Saturday, which is a little interesting. I mean, most of the time I remember growing up, it's not where we wanted to be. Saturdays and summers were ours. But for this population, once they begin to catch up, and you put them on a pace chart, and they begin to catch up academically, and they see the success, and that success breeds more success. And it's exhilarating, it's invigorating for them as well as the staff to watch them be successful, for them to knock off on their pace chart where it is, where they're going, and how they're getting there, and how long it takes them to get there. It becomes a big piece. So they become enthusiastic, they become self-directed, which is what we want. We want them to be self-directed, productive members of society. But without having the low student-staff ratios, the interventionists that are in every classroom, the individualized programs, the ability for us to be able to assess and diagnose and begin to treat and make them part of their treatment plan is really important. You guys have a wonderful credit recovery program in place. And I've gotten to meet Ezra Shine, who I just think the world of. He does a fabulous job in that population. What we try to focus on is keeping our group of kids from getting to the dropout rate. We want to decrease your dropout rate inside the cohorts. So to do that, if we can keep these kids a little longer than how the alternative school works presently, which is the ins and outs, the tagging in and tagging out, leaving them only for 45 days maximum, is not going to be very effective for this kind of population of kids that you guys are dealing with at risk. So to remove them, to be able to formulate the plans and move them along, have them be successful in long-term success would